I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm delighted to be able to join you this afternoon to talk about where we are with respect to COVID-19 for the entire state of Maine for today, Thursday, April 22nd, 2021. I start today's briefing with a sad note. Maine CDC has received the report of the death of another individual associated with COVID-19. That individual was a man in his 70s from Kennebec County, and his passing marks the 769th death associated with COVID-19 since we began our work on the pandemic. I'd like to take a second to offer our condolences to his friends, family, and community. Right now in the state of Maine, there are a total of 58,868 total cases of COVID, an increase of 403 cases since yesterday. Of the case investigations that were initiated yesterday, of those 403, 221 were among individuals that were diagnosed yesterday. 154 were among individuals who were diagnosed the day before on the 20th, and 28 were among individuals who were diagnosed on April 19th. Cumulatively across the state, there have been 1,800 hospitalizations related to COVID-19. And in the past 30 days alone, 150 people have been hospitalized. Right now, as we're talking, 119 people are in the hospital, 48 of whom are in the intensive care unit, and 18 of whom are on a ventilator. Our positivity rate for PCR tests conducted in the last 7 days has come down a bit. It now stands at 2.86%. For context, 1 week ago, that number stood at 3.5%. During that time period, our testing volume has remained robust. It stands today at 684 PCR tests for every 100,000. That high volume of testing gives us greater confidence in the accuracy of that positivity rate calculation. And again, the fact that it's come down is encouraging. Let's hope it stays that way. Turning now to vaccines and vaccinations. As of this morning, Maine had administered 1,040,866 doses of COVID-19 vaccine. 587,000 of those were first doses, and about 453,000 of those were among individuals who have completed their vaccination series by receiving both doses of Pfizer or Moderna or the single dose of J&J. To put those numbers in perspective, among Maine people aged 16 and over who are eligible for a vaccine, more than half, 52%, have received at least their first dose. And 4 out of every 10 people in Maine who are eligible for vaccine have gotten the shots that they needed. 4 out of every 10 people have gotten the shots they need. Now, I wanted to take a moment to provide an update around something we talked a bit about on Tuesday, which are so-called breakthrough cases. A breakthrough case is an individual who has been diagnosed with COVID-19 more than 14 days after after they are fully vaccinated. And being fully vaccinated means that more than 14 days have elapsed since you got your second dose of Pfizer or Moderna, or 14 days after your single dose of J&J vaccine. We talked a bit about those on Tuesday, and I wanted to provide an update as well as some context. As of right now, there are now 109 breakthrough cases associated with COVID-19 vaccines. But I think context around that number is really critically important. The first thing to note is that although there have been 109 of these so-called breakthrough cases, since we began vaccinating on December 14th in Maine, there have been 42,500 new cases of COVID-19. And again, about 109 of those have been among people who've been vaccinated. Also during that time, it's important to note that 453,000 people in Maine have gotten the shots they need. And of those 453,000, 109 have gotten COVID. Let me put that differently. 99.98% of people who got vaccinated did not get COVID or have not gotten COVID. To me, that is about the best and most ringing endorsement of the COVID-19 vaccine as you can find. One final note before I turn to some questions. It's been a while since we've talked about PPE and PPE distribution. I was just looking at my notes in preparation, and about a year and a couple of weeks ago, a year and a month ago, when we started these briefings, one of the things that I did every day was read out exactly how many N95 masks and how many pairs of surgical gloves we have. It seems a little trite and quaint to look back on those notes now. It's also a reminder, though, of how far we've come in the past year. Now, even though I don't talk about PPE deliveries every single day, and I look back on those notes and say, wow, look how far we've come in the past year, I do think it's important for folks to know that even though I don't read out the numbers of N95 masks that we have on hand or the number of gloves that we've delivered, that work hasn't slowed down. And yesterday, we reached a milestone with our PPE distribution. Yesterday, Maine CDC's Public Health Emergency Preparedness Team delivered its 6 millionth item of PPE, 6 million items. Now, we began delivering PPE in January of 2020, so about 15 months ago, and well before we even had our first case. We haven't stopped or slowed down since then. And again, we've hit our 6th millionth piece of PPE that we've delivered to healthcare providers, EMS clinicians, nursing homes across the state. Again, just want to take a second to thank the entire team at Maine CDC's Public Health Emergency Preparedness Program. They've been working in concert with colleagues at the National Guard and the Department of Transportation to keep getting PPE to people who need it on the front lines. So with that, I'd like to turn to some questions for the afternoon. The first question for the day goes to Morgan from WABI.
Hi, Dr. Shah. How are you today?
I'm doing well. Thank you, Morgan.
So my first question is about the Johnson & Johnson vaccine and what you feel that will do to people who are hesitant already to get the vaccine in our state.
Yep, Morgan, this has been a concern. The pause that's put into effect has had a concern associated with it that it may generate even more hesitancy around that particular vaccine. There are two important points to make, Morgan. The first is that the pause that was put into place and is now being discussed and evaluated with even more scientific rigor tomorrow. This is evidence of the safety system that we have in the United States. This is evidence of it working. There was a signal that was seen in a handful of individuals, one of which was during the clinical trials, a couple of which were after the trials. And because of that signal, things were put on hold so that scientists could continue evaluating, and those same scientists and experts will meet again tomorrow to evaluate that. This is exactly what we should ask of a safety system. It sees something and it says something. That's what we've got. The other thing that I would note, Morgan, is that there have been some surveys that have been done since the pause was put into effect, asking people what they thought of it and whether it shook or altered their confidence in the J&J vaccine. One of those was done by the de Beaumont Foundation, a well-respected public health foundation. And they found that about 76% of people, after learning about the pause and what led to it, found that it was the right thing to do and that it didn't alter their confidence in the J&J vaccine. Now, only time will tell what ultimately happens, but I think that early survey data suggests that, as we've done before, we talk to folks straight and honestly about what's going on. We don't necessarily run into a wall with hesitancy or confidence.
And I've heard of some cases of younger people who had issues with the Johnson & Johnson going to their medical providers, not in Maine, but other places. and their medical providers weren't convinced of their symptoms so much when it came to, let's say, the blood clots, whatnot. I guess my question is, if you're feeling something is not right, when you go to your healthcare provider, should you feel confident that they are going to, look at every avenue possible if you've had the vaccine?
You should feel confident in that. We in Maine have made sure that, in fact, almost immediately after the pause was put into place last Tuesday, one of the first things we did was draft up a statement, a scientific analysis of what was happening, and send that to healthcare providers across the state of Maine, letting them know what was known at the time by US CDC, and specifically, Morgan, what steps they should take if a patient were to come to them complaining of symptoms that could be associated with the vaccine, and how they should evaluate and approach that patient, what blood tests they should run, how they should, what types of CAT scans to ask for, what types of questions to ask the patient. That was one of the first things we did Tuesday late morning, just a couple of hours after we learned about this. And I think communications like that are instrumental in making sure the medical community is up to speed on what's happening, but also in building confidence among Maine people, such that if they go to the doctor's office, their doctor will know what to do and how to do it in order to take their concerns seriously.
Thank you.
Over to Patrick Whittle next.
Well, thank you very much. A couple things. Is there any update, first of all, regarding where we are with the mobile unit and sort of attempting to use a new model there, since the J&J vaccine is not available?
Yeah, Patrick, I'm really glad you asked that. The mobile unit is getting the job done. Our initial planning assumptions for the mobile unit were that it would do 250 to 300 doses a day. Once we saw the team in action, we upwardly revised that to close to 400. But yesterday they did more than 500 doses in one day. Most of those, I'm sorry, not most, about 280 of those were walk-up doses. Folks who did not have an appointment, but for whom going to the Wyndham Mall on their lunch break or before they went and picked their kids up or what have you was the convenient option for them. That's exactly, as you've heard me talk about, the direction we're trying to go with other sites across Maine. But we're really thrilled with the performance of the mobile unit. I'm really, personally, I've had a chance to visit it at each of its stops. I'm going to pop by there on Biddeford on Saturday as well. I've also been really thrilled to see the team come together and really just get this mission done. So Biddeford's up next, starting Saturday morning, and very excited for what they're going to accomplish there.
Are there plans for more walk-up options in the future, both via the mobile and elsewhere? Is that sort of the model we're trending toward at the moment?
Patrick, there are plans in place. I don't know if it's the model, as you noted, but it is a model. And what I'd like to see happen more, what is happening more, is that sites are building in specific blocks of time during a day, or maybe even in the future, specific days that are unscheduled. So for example, Franklin Memorial Hospital is walk-up right now. That's what works for their community. Other sites, it may be just a few hours, maybe before work, during lunch, after work. Other sites may do it in slightly different ways. We've worked with a number of different locations across the state of Maine to see what might work best for them. But that is a model that I'm encouraging providers and sites to start adopting. I don't think it's the model, but it is a model. And the experience that we've seen in Wyndham this week suggests that it's a model that meets the needs of Maine people where they are.
Okay, thank you very much.
Over to Marissa, WGME next.
Hi, Dr. Shah. I wanted to go back to vaccine hesitancy for a moment. An analysis by the Kaiser Family Foundation that just came out recently suggests the US could run out of adults who want the vaccine in a matter of weeks, 2 to 4 weeks. Are you seeing any signs of that type of hesitancy here in Maine?
Marissa, that's a good question, and I'm glad you raised that. We have not seen that degree of hesitancy. There have been states where that has been what they are encountering. They are shifting their concepts of operation away from large scale sites and EMS clinician clinics, more toward doctors' offices and such, because that one-on-one experience is what they are finding will get the job done. We haven't seen that in Maine, although it's a possibility. What we're seeing continues to be appointments open up, and for the most part, they're snapped up. For example, in Biddeford with the mobile unit, many of those appointments have already been snapped up. Now we're working on how and in what capacity we can do walk-up hours as well. But it's a concern, that degree of confidence or hesitancy creeping in. As we talked about on Tuesday, there are different degrees of folks who are not getting vaccinated. And I think it's important that we not analyze the problem as if it were a monolith. Different folks have different reasons for why they haven't been vaccinated. For some folks, we've got to make it such that vaccines work for their schedule. For other folks, they've got earnest questions, and our job is to provide them honest scientific answers. Other folks are just set against getting a vaccine of any sort. There, we've got more work to do. Maybe their doctor can play a role in that. So we're not saying that hesitancy or a lack of confidence will never materialize here in Maine. Possibility. What we're doing is planning for how we talk to different groups to get them on board with vaccinations.
Yeah, that was kind of my follow-up question as well, is if we do run into this down the road, does the Maine CDC have a plan for how to address that?
We do, and we've already been putting that plan into place. We've got PSAs that are out there. We've got the conversations that we have. From time to time, as you know, I take questions that folks have raised with us to answer them directly. We've got a campaign that's going on social media where folks can pose questions at our Facebook page that we answer, that I answer. And then we're also planning for other types of campaigns. There are, again, two distinct categories of folks that we want to talk to. Some groups are interested in getting a vaccine, but we need to figure out a way to make it work for their busy schedules. That involves telling them how, when, and where they can get a shot and how to find one. Another group are folks that have questions. That's a slightly different conversation, but we can have both of those conversations at the same time. That's where we are right now. Let me turn it over to Megan at WMTW next.
Thank you for taking my question, Dr. Shah. The rapid home, excuse me, the rapid at-home tests that are going to be sold in pharmacies, can you speak to their relative reliability and the people that are coming back to Maine who are traveling? We talked a little bit about this on Tuesday. Would you say that the at-home tests are a good option for them, or should it not be an option that they explore?
No, Megan, great question. So let's just to level set a bit. What Megan's referring to are a type of test that's already been on the market, but now the FDA, the US FDA, has authorized it to be something that you don't need to get a doctor's note for. You can go into a pharmacy and buy it over the counter, or what's sometimes called behind the counter. Just got to ask for it. You don't need a doctor's note or anything of that nature. It's really easy and straightforward to use. You swab the swab in your nose and you stick it in a cartridge, and then about 13 to 15 minutes later, you've got your result. It's a good option, Megan, and I'm glad you raised it. The test is one that we've already been using in the United States for a while. It goes by the same name called Binax Now. It's called an antigen test. Sometimes I talk about antigen test positivity rates here, for example. It's the same test. They've just amended it a little bit with smaller vials of chemicals rather than the bigger ones that we use in places like schools. It's a good test. It works really well. It works the best if you do it a couple of times. And so if your family is coming back and you find out that you want to make sure you're clear to go before you go back to the office or before you go back to the kids go back to school. It's a great test. It works really well once, but it works particularly well if you run it twice or even more. That's what's called serial testing. You don't necessarily need to limit yourself. You can do it just once and it works really well. But if repeating it a few times is something that's an option for you, the test works even better there.
Is there a time frame to which you'd get the best results? So let's say you come back on a Friday, or should you wait a few days before you test?
No, so what you should really do, and this kind of goes back to the testing multiple times, the best thing to do is test right when you get back. If you can also, however, test right before you go back to the office or to school, doing it twice improves the odds of getting a right result. So you don't necessarily need to do it twice. That's if you really want to do belt and suspenders. But getting tested right when you come back, that's a great time to do it, whether it's at this take-home test at the pharmacy or at one of our swab and sends. But if you're doing the pharmacy test, you do another one right before you go back to the office, right before the kids go back to school. That increases the accuracy of the results.
Thank you.
Let me go to Amy Brown next.
Thanks, Dr. Shah. Looking back through my records, it looks like this 48 is the highest number of people that have been in the ICU since sometime in around mid to late January, when numbers started falling again. Is it proportionate to the number of cases? Like, is it sort of the same percentage of positive cases as we've had all along, or is the number of people being hospitalized changing in terms of the percentage of people with COVID?
Yeah, that's I like that. Thanks, Amy. That's something that we've been thinking about. So you are correct. The number of ICU admissions right now is higher than it's been in recent months, and there has been a bit of parity between the number of cases we have per day and hospitalization rates. And that relationship has largely held steady, but I will say in the past 8 or 9 days, that curve has shifted a little bit. As you'll recall, Amy, about 8 or 9 days ago, we were having largely the same number of cases, maybe just a hair fewer, and we had about 75 to 80 hospitalizations. Now our case numbers have increased a bit, but our hospitalizations have gone up, and we're now regularly above 100, as you saw today, 109. So that proportion has gone up. That's of concern. We have looked into what's going on. Is it concentrated or is it dispersed? There is a bit of concentration in Androscoggin County and Kennebec County as two areas that are seeing higher than average hospitalizations, but otherwise it's generally dispersed across the state. So that sort of tells us by implication, Amy, that the virus is everywhere. We're not necessarily seeing this as a byproduct of what I've called focal outbreaks, but rather community transmission happening across the state.
And is there any change in the age ranges of those who are hospitalized? Can you say anything about like the range of people who are hospitalized currently at their ages?
Yes, absolutely. So if you take a look back, if you zoom back to, let's say, December of 2020, right before vaccination started, the average age of people hospitalized in Maine back in December of 2020 was 74. Now it's fallen to about 65. Now that may not seem like a lot, but that's the average. That means that half of the people who are hospitalized now are under the age of 65, 66. Back before then, back in December, that age range was much higher. So that's a relatively pronounced fall in the average age of folks who are in the hospital. It won't surprise you to learn that much of that is because younger folks are being hospitalized. Now, not in significant numbers. Younger folks, although they are hospitalized more relative to everybody who's hospitalized, the rate still is low. That's a good thing. But we are seeing more and more people who are accounting for, more and more young people who are accounting for hospitalizations every single day in Maine.
Okay, thanks. And back to breakthrough cases again. Are there any patterns or common elements emerging among the people who experience breakthrough cases, age, or maybe prolonged contact with somebody who is symptomatic or anything like that?
No, it's a good question, Amy. Not in particular. We haven't determined that there was anything epidemiologically, like you noted, their type of exposure, where they were exposed. Haven't noticed any commonalities, nor have we seen strong patterns as it relates to age or anything of that nature. You might hypothesize that as one gets older, their immune response may not be as robust, but we haven't seen a strong pattern along those lines yet. So, we are looking at that. It's the exact right question to ask. We haven't seen anything emerge. At the same time, and this is a good side of that story, with only 109 breakthrough cases, that's not a large sample in which to really detect trends or anything.
The US CDC looking at it overall, though, big picture across the country with the breakthrough cases at all?
That's my understanding. There have been over 5,000 breakthrough cases reported nationwide. And again, even there, I haven't seen any rigorous or formal analysis looking for defined trends yet. But as they accumulate more nationwide, it's only a matter of time before the CDC publishes something.
Okay, great. Thank you.
Yep, thanks, Amy. Over to Emily at the Sun Journal.
Hi, good afternoon, Dr. Shah. So my first question, I want to focus on Androscoggin County. And like you noted, the positivity rate continues to be high. And I think it's worth asking again, what do you believe is driving this high positivity rate in Androscoggin County? And second, the county also has some of the lowest vaccination rates. And do you see any connection between the two?
Yes, as to the latter. You are correct. Right now, if you focus in on the percentage of the population in the county, that has completed or received, completed their vaccination series, either received both shots or the single shot of J&J. Androscoggin County is 16th right now. That's a concern for very obvious reasons, and that is one reason, I think one of perhaps a couple where and why Androscoggin's case rates as well as positivity rates are high. But let me talk about the epidemiology just a bit and then what we're doing about it. The epidemiology here partly was related initially to a sizable outbreak at Bates, but that outbreak has largely subsided. In their latest round of testing, they only found one additional case. That's a good sign, but these things are not distinct from one another. Cases at Bates are also a function of cases in the community and vice versa. So what we are continuing to see in Androscoggin County is not increases in cases driven by these focal outbreaks. To go back to Amy's question, it's not outbreak driven specifically, it's community transmission driven. Really, there are the classical tools to get a grip on community transmission, and then there's the new tool. The classical tools are masking, physical distancing, so on and so forth. The new tool is vaccination. So we are working to try to increase vaccination rates. Some of it is making sure that there is adequate demand. I'm in pretty frequent contact with a handful of medical providers in the Androscoggin County area to get a sense of the demand they're seeing, whether we need to send more vaccine their way, that sort of thing. But simultaneously working with others to see how we can stimulate demand. Do we need to do more PSAs? Do we need to have different hours? Do we need to bring vaccines even closer to people? We're working on all of those things to make vaccine the easy option in Androscoggin County.
So I just want to follow up on the vaccination rate. What do you believe is driving that low vaccination rate? Have you found that it is that there is not enough supply for the demand? Is there more hesitancy? What do you believe is causing that?
We've looked at different hypotheses. We're seeing mixed reports when it comes to the availability of slots. Some of the larger scale vaccination sites do have appointments available. So message one, if you are in Androscoggin County, you'd like to get vaccinated, there are openings available. Some of the pharmacies have reported that they are filling their spots. So there's a little bit of both there. We're continuing to supply 3 trays of Pfizer at least to, for example, the Auburn Mall. But we're also trying to get a better sense from community leaders whether there are concerns around confidence around the vaccine. And as you say, that would be the demand side of the equation. I don't have a good sense of that yet. That's a difficult thing, as you can imagine, to quantify and track and measure. So we're trying to get a better sense of that. As we've talked about already just today, Emily, competence is not a monolithic thing. There are different degrees of competence, and we've got to get a better understanding. Is it driven by the need for convenience, or is it driven by questions, or is it driven by folks who are at the outset dead set against vaccination. There is a different conversation for each of those groups. That's what we're focused on right now.
Thank you. So my last question is, with the case rates in Androscoggin County continuing to remain high, are you at all concerned about the May 1st deadline, or rather reopening for exemptions from travelers from other states, and reopening in general, as the weather gets warmer, more people are being outside and so on and so forth?
Sure. So as to the May 1st deadline, no, that doesn't give me much pause, and we don't have any planned policy changes in the works in light of that. In terms of the warmer weather, that's a boon. That's a good thing. If it means that more people are outside, that lowers the likelihood of transmission. That can only work in Androscoggin County's favor. Over to Joe Lawler next.
Yes, hi. Just checking on the supplies for next week. We saw from a news release from DHHS that Moderna supplies seem to be more than double what they were. And that's actually different from what the federal government released yesterday. So if you could just kind of explain what's happening there. And related to that, if the feds decide tomorrow to lift the pause on the J&J, does that mean we'll get J&J's supplies starting next week, or will we have to wait another week after that?
Got it. Thanks, Joe. Let's, as to the former, you're right. Maine is going to be receiving a really healthy, robust amount of Moderna vaccine next week. I'm not sure why the US CDC's website has a different one than what we see in our dashboard that we have with Operation Warp Speed. We've actually alerted them to that. I don't think we've heard back yet, but I'm not sure why there's a discrepancy there. But you're right. We're getting a high volume of Moderna next week, and that's a great thing. I'm really excited about vaccinations in Maine next week, even with just the Moderna vaccine. And as you'll see on the allocation spreadsheet, Joe, I'm really pleased next week. We're going to be supporting EMS clinicians in particular. I had the chance to meet with them late last week, and they are eager to get in and stay in the vaccination game. And we want to equip them. So you'll see next week thousands of doses that our EMS clinician colleagues across the state of Maine are going to be receiving and then putting into arms. I've visited a couple of vaccination clinics run by EMS agencies, one in Lincolnville, one in Buxton, and they are the paragon of efficiency. So I'm really excited to be able to support EMS clinicians in getting shots into arms. The thing that is on the spreadsheet, but it requires a layer of peeling back, Joe, is the work that we're doing to support what we've called these pop-up equity clinics. Small clinics, often operated by, say, independent pharmacies, that are going on site to groups that are hard to reach to provide vaccine on site to them. Because of the additional Moderna vaccine we're getting, we're really pleased to be able to support these clinics. We're also supporting a lot of the work that's been going on already at, say, hospitals. As I mentioned a moment ago, some hospitals and other providers are starting to incorporate unscheduled hours. Having Moderna vaccine for those is a great way we can support that, say, for example, at Franklin Memorial and places like that. Others we know we're working with to experiment and do pilots with unscheduled hours as well. It's another great use for Moderna. And then, of course, as you see on the spreadsheet, Joe, we're planning for the mobile unit to consistently be doing 500 shots a day. That's why you see 3,000 on that line there. So we're excited about this. This is going to be a big week for vaccinations in Maine. As for the J&J piece, we'll know more. Even though the advisory committee tomorrow may vote to lift the pause, they may not. We'll see. There still needs to be official action taken by the principals at the FDA and the CDC. If they officially, in turn, lift the pause, then we at the state level are already preparing to communicate with providers around what that means for them and how quickly they can pivot back to J&J if they've got it on their shelves.
Okay. And then I just quickly piggybacking on that, if you could explain the independent pharmacies and what role they will play with Moderna. And then Also, one of the things we did statistically is just took a quick look at the 7-day average of doses administered this week compared to last week, and then backing out the J&J. So just to compare Moderna, Pfizer in those 2 weeks. And there was fewer dose, about, a couple thousand doses, maybe 1,500 doses per day less administered in this previous week compared to the 2 weeks ago. And is that a reflection of a softening demand, or is there a way to explain that?
Yeah, so Joe, let me start on that piece. I've done that same analysis, and when I ran it, most of what I saw, so there has been a decrease in the number of doses administered per day in Maine on a 7-day average basis. But when I ran the analysis, it was largely explained by not having J&J vaccine. Here's what I mean. The pause came at a time when the volume of J&J vaccine that was coming into the state was quite high, 20,000 doses, and then I forget the exact number the week after. So we were already at a very high point. The pause, of course, last Tuesday froze all of that immediately. And so we went from at a high point administering on a 7-day basis about 18,200 doses per day, now down to about 13,600. That's on an adjusted 7-day basis. But that accounts for the way that I, as I analyzed it, it's largely explained by the fact that all the J&J that would have otherwise been used, around 25 or so thousand doses, was just on hold. There might be some other factors, a bit of softening of demand, but to me, the predominating reason is the lack of ability to use J&J. Certainly, there's a lot of factors going on at once, so I'm not discounting the possibility of a little bit of softening of demand, but by my lights, it's really a function of J&J. We shall see. As to the independent pharmacies, the work that we're doing there, and I should also mention federally qualified health centers who are also receiving a pretty high volume of Moderna this week. The independent pharmacies in particular are participating with us in these so-called pop-up equity clinics. The way that works is that we receive applications from those who would like to sponsor such clinics for a particular group that is hard to reach. We pair those with groups that can provide the vaccination. In some instances, it's EMS clinicians. In other instances, it's independent pharmacies. We pair them up, and then they're off to the races. And that's really where we see independent pharmacies in the coming week being really great partners.
Can you quickly define what a pop-up equity clinic is? Thank you.
Sure. So what we did, around about a month, maybe even longer, maybe 6 weeks ago now, was recognize that there are certain groups of folks who are particularly hard to reach. Maybe they are extremely reticent to go to a large site. Maybe they don't have the transportation needed to get there. We also saw that there were groups like independent pharmacists who were willing, ready, and able to go to those groups of people to provide vaccine. So what we did was create a system, it's on our website, where those who are representatives of those groups can apply, and depending on vaccine availability, we will pair them with a group of vaccinators. And this is what we're calling the equity pop-up clinics. The focus of this group, the focus of these efforts is around health equity. That's the lens that we are looking at this through. So it's not so much that they are solely hard to reach, but it's also that from a health equity point, they may be disadvantaged in some way. That's what we're calling these equity pop-up clinics. And we've been working with independent pharmacies in particular to make those happen. Let me turn it over to Caitlin Andrews next.
Hey, good afternoon, Dr. Shah. Wanted to kind of follow up on a question that Amy Brown had about hospitalization age trends. So even though we're seeing like a little bit more of younger people being hospitalized compared to December, they've still relatively been low populations of them hospitalized, and older Mainers are certainly still predominantly making up that trend. And I'm wondering what you think of that, given that older people are predominantly the ones who are vaccinated in the state.
Well, a couple of notes there, Caitlin. It's a mixed bag on the younger folks. So if we go back to, again, September, October, if you look at folks who were in their lower than 50, we'll just take September of 2020. You take a look at folks who are younger than 50, back in September, there were 9 people that month who were hospitalized in that age category. In October, it was only 3. This month, it's 18. So that's again, numerically not a high number, but that's a lot. That's a lot of folks who are younger, on the younger side, who are being hospitalized. Again, it's getting vaccinated is the best way to stay out of the hospital, goes without saying. But in terms of on the older side, although older folks in Maine do account for the higher share of who's been vaccinated, and their rates of being hospitalized have come down, as evidenced by the fall in average hospitalization rates, not every older person in Maine is vaccinated yet. So I think that much of what we're seeing right now in terms of hospitalizations is being driven by the fraction of folks who are not yet vaccinated.
What do you think those numbers kind of say about the current pandemic situation in Maine?
Tell me a little bit more about where you're going, Caitlin.
I guess I'm kind of curious about, with all those factors kind of together, what do you think that kind of says about where we, like, is this something that we could expect given, national trends, like where vaccination efforts are, or is this kind of like unusual to you?
I think it is. I don't think it's unusual. I've seen similar data from some other states as well. That is to say, cases trending younger, hospitalization rates trending younger as well. So I don't think it's unusual. The nationwide, generally speaking, older folks were those who were vaccinated first in virtually every state. So I don't think this finding is surprising or unusual. It is concerning because younger folks are being hospitalized, younger folks are in the ICU, but it doesn't strike me as something that was unpredictable or out of the ordinary given what we've seen with COVID so far. That is to say, it affects younger people. Certainly not at the same rate as older people, but it does affect younger people.
Mm-hmm. Can you talk a little bit about the differences in how it typically affects younger people versus older people, or what we've seen generally?
Yeah, physiologically, it affects them, or medically, in largely the same way. Thankfully, their overall rates of needing to be hospitalized or put in the intensive care unit or put on a ventilator are lower. If you're in your 20s, your likelihood of needing to be on a ventilator is lower than if you're in your 80s and you're unvaccinated. But when it affects people in an aggressive manner, it affects them in the same and in difficult ways. It can cause pretty rapid collapse of your respiratory system. It can necessitate being in an intensive care unit. It can also, and we haven't really talked about this, have these longer term symptoms, what has now been known to be called as long COVID. There's a lot of research going on about what long COVID is, why it happens, who it affects, why it affects them. But younger folks have been affected by it. Really, you only have to pick up or tune into any news outlet these days to listen to younger folks telling their stories about being affected by long COVID. We don't have a good sense of why yet, but there's a lot of research underway to figure that out.
Thank you.
Thanks, Caitlin. Over to Pat Callahan next.
Good afternoon, Dr. Shah. I'm wondering what your latest thinking is on whether being fully vaccinated prevents people from being able to spread COVID to others.
Yes, Pat, almost, it seems like every week now, the strength of the evidence suggesting that fully vaccinated people do not pass COVID on to others, the strength of that base of evidence grows stronger and stronger each week. Again, it seems like about once a week, there is a well-done study from somewhere published in a highly reputable medical journal and vetted and peer-reviewed, adding to the sum of what we already knew before. And all of that evidence is pointing in the same direction, which is that fully vaccinated people for the most part, do not transmit COVID to others. Can it happen? Yes. In fact, we've had a couple of cases here in Maine. These breakthrough cases are slightly different from what you're talking about, but they do suggest that in 0.02% of the cases, someone who's fully vaccinated can be affected by COVID and diagnosed. But that's about where we are on the other side of that question, which is, can you also transmit it? It seems to happen, but vanishingly rarely. That's a really good thing because it suggests that the vaccines have so many benefits. Vaccines not only keep you safe, not only keep you out of the hospital, not only keep you off a ventilator, but by being vaccinated, you reduce the likelihood that you might inadvertently spread COVID to somebody else as well. And again, every single day, the strength of that evidence grows.
Getting back to your suggestion that there may well be some softening of demand across the state, how does that affect our goal of herd immunity in the coming months? Does it mean we're just going to have to live with this, with the masking and with the restrictions as we go forward, because we're not going to reach that point?
Pat, I don't think so. We are, even though some states have candidly seen their demand fall off a cliff, that to use the words of one of my counterparts in another state, we have not seen that in Maine. There have been, in some instances, some spots that have not booked out all of their vaccine appointments, but we're not seeing this widespread decrement in demand. So I'm optimistic, and we're doing our part to generate as much demand as possible by not just talking about the benefits and the safety of vaccine, but making structural changes to our vaccination system to make getting vaccinated the easy choice. We've talked a lot already about unscheduled blocks of time. Just show up. We're talking a lot more with sites about hours that work for people who are working. Early morning, later in the day, at lunch, in the evening. So we're talking more about bringing vaccines literally door to door to people. So we're going to do our part to keep those rates up. We want to get to that 75, 85% threshold. And whatever we've got to do, that's what we're committed to doing.
Thank you, Dr. Shah.
Thanks, Pat. Last question for the afternoon goes to Robbie Feinberg.
Thanks, Dr. Shah. Just one quick question about the breakthrough cases that you talked about. How severe are these cases? I mean, are people hospitalized? What are they like?
Great, thanks, Robbie. I mentioned this on Tuesday. I should have mentioned it again today. Among the other findings, kind of going back to Amy's question about what we're finding and seeing in these cases, I'm glad you raised this. What we're finding and seeing in these breakthrough cases is that their rates of reporting symptoms are far lower than among unvaccinated people. Lower, not far lower, lower than among unvaccinated people. Their rates of hospitalization are lower than among unvaccinated people. And critically, their rates of being critically ill, needing to be in the ICU or needing to be on a ventilator are zero. So again, yet another benefit of being vaccinated. If you happen to be in that 0.02% of people who gets COVID, your likelihood of needing to be severe, your likelihood of having severe disease is zero.
Great. Thanks, Dr. Shah.
Thanks, Robbie. One note to close out today on. There have been some questions that I wanted to just address around second doses. I talked a little bit about this on Tuesday, and I wanted to just talk a bit more. There are a couple of questions right now. The first is, for folks who got vaccinated at either by the mobile unit in either Oxford or Windham, you received the Moderna vaccine. How and when are you going to get your second shot? Our plan right now is to swing the mobile unit back to Oxford and to Windham at the right time so you can get your second shots. We've got somebody who is tasked with being in touch with you to communicate with you about how to get your appointment set up. We are intending to, again, swing the mobile unit back around so that you can get your second shot in the same setup, in the same way that you've already seen when your time is there. That's our preference, and that's what we'd like to achieve. At the same time, there may be folks for whom getting that second shot at that time doesn't work. If that doesn't work for you, you have the option of going to another vaccination site for your second shot, but that's not our preference. Our preference is that you get your second shot in the same way with the same folks that you got your first shot in. And that's something I'd like to talk about a little bit more generally. We've received reports from folks who aren't able to get their second shot when they needed to, at the time they needed to, at the same place they went the first time. I recommend that when you go somewhere for your vaccine, you make every effort to get your second shot at the schedule that's set, 21 or 28 days, and at the same place that you got your first shot. That's what we recommend, and that's the best way to go about it. It's the best way for you because you know the system, you know where to go, you know how to get there. It's also the best for the site because the way that we ship doses around is that if a place gets 100 doses of Moderna next week, 28 days from now, they're going to get 100 as well for those second doses. That's the way we set the system up. And that's what I recommend you do. But if that doesn't work for you, if you're in that rare group for whom that doesn't work, you can go somewhere else, but it's not our preference. We really urge you to try to get your second shot the same place that you got your first shot in. With that, I wanted to thank everybody for your time today. Really appreciate everyone tuning in. Thanks as always to all of our colleagues in the media for the great questions today. We look forward to chatting with everyone again soon. In the meantime, as always, be kind, take care of one another. We'll catch up with everyone next week.